How to design a dryland training program. With all the information out there, designing a dryland training program can feel overwhelming. In this video, we're breaking down how we design our dryland training programs for aquatic athletes on a macro scale. We'll break down assessments, the training program, and injury risk reduction principles. Assessment. All of our dryland training programs begin with an assessment of the individual or team. The assessment helps us tailor a training program specific to what the individual or team needs. Assessments are like diagnostic checks for car mechanics. They help identify areas that need improvement, areas that don't, and the types of training that will benefit the athlete the most. Note: assessments for teams are more general than individual assessments. They provide an understanding of the general training age of the groups, equipment availability, and competition schedule. For the sake of the video, we'll be discussing assessments for individuals. We break down our assessment into three components: mobility, movement, and performance. Mobility. Here's a list of assessments we found useful in identifying potential mobility restrictions that may limit performance or increase injury risk. We'll briefly discuss each of them. Active and passive shoulder flexion. Shoulder flexion is bringing the arms overhead. There are many assessments you can use, like the back-to-wall shoulder flexion or Leahy stick test. The assessment shows us an athlete's ability to bring the arms overhead without compensation from the torso or pelvis. For aquatic athletes, this is one of the most important assessments to pass. Limitations in shoulder flexions may lead to suboptimal streamline positions, disruptions in body line, limit distance per stroke, and increase injury risk. Humeral external and internal rotation. Humeral external rotation is the upper arm rotating backwards, and humeral internal rotation is the upper arm rotating forwards. Because swimming propulsion is created through humeral internal rotation, we've noticed athletes tend to lose external rotation mobility throughout their careers. Limitations in humeral external rotation may lead to limitations in shoulder flexion, the ability to get overhead. Anecdotally, developing and maintaining sufficient active external rotation mobility is one of the best ways to reduce the risk of injury and maintain good overhead mobility. Limitations in humeral internal rotation may make it difficult for athletes to achieve an early vertical forearm when setting up their catch. However, please be cautious when attempting to improve humeral internal rotation and consult a qualified professional or physical therapist before doing so, as increasing total range of motion and using controversial stretches like the sleeper stretch may increase injury risk. Lat length. Mobility in the lats are essential for maintaining adequate shoulder flexion mobility. This assessment helps us determine if tight lats are causing limited shoulder flexion, as it's possible for an athlete to have good lat mobility but still struggle with shoulder flexion from other areas. If we see that the athlete has good lat length and poor shoulder flexion, we can determine that the lats aren't the issue. Pec major length. This assessment is similar to the lat length test in that it helps identify if the pecs are responsible for poor shoulder flexion mobility. Limitations in pec major length may also limit distance per stroke and increase injury risk. T-spine rotation. T-spine rotation is rotation of the upper back. Like shoulder flexion, T-spine rotation is one of the most important assessments to pass. Good T-spine mobility allows swimmers to freely get their arms out of the water during the recovery phase, and water polo athletes to load their arms before shooting a ball. Research by Anderson et al. Has shown that sprint swimming requires more T-spine mobility than distance swimming because of the reduction in hip rotation during sprint swimming. Limitations in T-spine rotation may also increase injury risk. T-spine extension. T-spine extension is the extension of the upper back. Limitations in T-spine extension can impact an athlete's streamline and underwater dolphin kicking performance. T-spine extension is also necessary during the butterfly catch phase and when water polo athletes shoot a ball. Hip internal rotation. Hip internal rotation is the femur rotating inwards or the ankles moving outside the knees. Good hip internal rotation assists with an efficient and healthy breaststroke kick and egg beater. Hip external rotation. Hip external rotation is the femur rotating outwards or the ankles moving inside the knees. Good hip external rotation assists with an efficient and healthy egg beater and change of direction for water polo athletes while enabling good movement quality on land. Hip flexor and quad length. The hip flexors are muscles that decrease the distance between the thigh and torso. Shortened hip flexors can restrict hip extension, which may reduce kicking range of motion and increase injury risk. Shortened quadriceps may also increase injury risk. However, their impact on performance is not yet fully understood. Hamstring length. Shortened hamstrings can restrict hip flexion and knee extension, potentially limiting kicking range of motion and power. Testing hamstring length can also indicate weak hip flexors, which are essential for kicking speed. Dorsiflexion. Dorsiflexion is the movement of pulling the top of the foot up towards the shin. Adequate dorsiflexion mobility assists with an effective and healthy breaststroke kick, egg beater, and squat. Plantar flexion. Plantar flexion is the movement of pointing the foot downward away from the shin. Adequate plantar flexion mobility assists with an effective dolphin and flutter kick. After identifying which areas are restricted, we make note of the individual restrictions in a proprietary database and design mobility training programs specific to each individual. This helps us accomplish two things. First, it helps us ensure we're not mobilizing hypermobile athletes. Second, it helps us target specific areas. For example, an athlete may have tight hamstrings and hypermobile shoulders. This athlete would need to train lower body mobility and not upper body mobility. There are two components to mobility training. The first is mobilizing the muscle or joint that is tight. This is where we use passive, assisted, dynamic, or PNF stretching. The second is training the opposite muscle to move the short muscle into the stretched end range. End range is the last bit of motion a joint can move. For example, an athlete with tight hamstrings could use a rack-supported hip flexor liftoff to train the hip flexor muscle and bring the hamstring muscle into a stretch position. If you'd like a step-by-step guide on how to assess your mobility, we have a free mobility module in the video description below. Movement assessment. The purpose of the movement assessment is to get a general understanding of how the athlete moves and how strong their body control is. We're looking for things like, how do their scaps move during a row? Does it retract? Does it tilt anteriorly? What does their pelvis do during a push-up? Are they lordotic? What does their neck position look like? Can they hip hinge? What does their foot do during a squat? These questions give us an insight on how the athlete moves, if there are any red flags, and how we should initially approach the athlete's training. Performance. Performance assessments or key performance indicators give us an insight into how strong and powerful an athlete is. It tells us how we should allocate our training time and what qualities to develop first. For swimmers, the KPIs we use are the non-counter movement jump, broad jump, 1 rep max weighted pull-up, trap bar or back squat velocity test, and assault bike max watt test. We use the same set of tests for water polo athletes, but add a single leg lateral broad jump to test frontal plane power. The non-counter movement jump gives us insight into general lower body power and how hard an athlete could push off the wall. We use the non-counter movement jump because there is no counter movement in swimming or water polo. A counter movement is when a jump is preceded by a quick downward motion. Normative data on the non-counter movement jump varies depending on the device used to measure the jump. My advice is to try to always use the same device to develop your own normative data. The broad jump gives us insight into general lower body power and athleticism while telling us how far an athlete could potentially dive off the blocks. In 5 years of testing, we've observed elite aquatic male athletes to jump greater than 100 inches or 254 centimeters, and elite aquatic female athletes to jump greater than 80 inches or 203 centimeters. Obviously, these are averages and standard deviations and outliers exist. The 1 rep max weighted pull-up gives us an insight into an athlete's upper body pulling strength. We take the 1 rep max, add the athlete's body weight, and divide it all by their body weight. This gives us a relative score. For example, my best 1 rep max pull-up is 108 pounds or 49 kilograms at a body weight of 205 pounds or 93 kilograms. That would give me a pull-up ratio of 1.53. We've observed that elite aquatic female athletes are somewhere in the 1.2 to 1.5 range, while elite aquatic male athletes are in the 1.4 to 1.8 range. If an athlete can't do a pull-up, that becomes one of the first priorities in their training program. The trap bar or back squat velocity test is our version of testing lower body strength in a safe manner. Instead of using a traditional 1 rep max where we risk injury, we have our athletes trap bar deadlift or back squat 1.25 times their body weight as fast as possible. It's not a true measurement of maximal strength, but if maximal strength improves, the athlete's ability to move 1.25 times their body weight should also improve. Note, we only test this once the athlete shows proficiency in the trap bar deadlift and back squat and can lift more than 1.25 times their body weight. The assault bike max watt test is an all-out sprint on an assault bike for 10 to 20 seconds, and we look at the highest wattage an athlete can achieve. It gives us insight into how much power an athlete can generate. We take the max watts and divide it by the athlete's body weight in kilograms. For example, I've hit 1900 watts on the bike at a body weight of 93 kilograms. That would give me a relative score of 20.4 watts per kilogram. In 5 years of testing, we've observed a range of 3 to 21 watts per kilogram. The training program. Now that we understand the athlete, we can begin designing a training program. We use something we call the bucket system to design our training programs. This concept is not new in the performance training world, but the name helps illustrate the point. All humans present with an endless number of buckets. A lower body strength bucket, a lower body power bucket, an upper body strength bucket, an upper body power bucket, a mobility bucket, a psychology bucket, etc. The assessment helps us identify how full each bucket is. Our job as performance coaches is to fill the buckets with the least amount of water and have the greatest impact on performance first. For example, if a swimmer can't do a bodyweight pull-up but can jump high, we would consider their upper body strength bucket to be less full than their lower body power bucket. Our job would then be to pour lots of water into their upper body strength bucket while trickling water into their lower body power bucket, ensuring we don't lose water from evaporation, aka detraining. Priorities. If an athlete struggles to perform a perfect push-up, chin-up, goblet squat, iso split squat, hip hinge, plank, or a 30-second hip extension iso, giving the athlete the ability to perform those movements becomes the priority in their training program. Just like we learn the alphabet before we begin writing novels, we must learn the fundamental movements before we can begin any complex training program. These fundamental movements are the building blocks on which we build the athlete. Advanced movement targets. Advanced movement targets give us objective goals and progressions on muscle groups that are difficult to track with numbers. For example, it's easy to track if our upper body pulling strength is improving by tracking our weighted pull-ups or seal row numbers. However, tracking progress on muscle groups like the core can be harder to do objectively. Advanced movement targets also give us a loose definition of the word athleticism. We believe that developing the capacity to perform these movements develops a more complete and athletic human being. Here are the advanced movement targets we currently use: the standing ab wheel, the front lever, the pistol squat, and the handstand. These movements provide a target that help us reverse engineer an athlete's training program through regressions. These movement targets serve as a roadmap outlining progressions and regressions, with the final movement target marking the destination. For example, if the destination is the standing ab wheel, the roadmap might look something like this. Once we understand where the athlete is in terms of their strength level, we place them at the appropriate spot in the progression that is achievable, yet still challenging for the athlete. We use movement targets that are difficult to achieve on purpose, as it provides a long-term progression pathway ensuring athletes continuously improve their capabilities. This same concept can be applied for easier movements like the push-up and chin-up. However, the complete progression pathway will be shorter as there are less progressions required. The warm-up. The warm-up is a time to prepare the tissues and nervous system for training. We always begin with some type of temperature elevation unless they are coming directly from practice. After elevating temperature, we go into soft tissue work. Following the soft tissue work, we go into mobility and activation work based on the athlete's individual needs and the training priorities of the day. For example, if an athlete presents with the following and is preparing for a squat day, we might prescribe this. If the athlete is hypomobile, we'll follow their mobility work with some activation work like the TRX face pull and box jump. If the athlete is hypermobile, we'll generally focus on activation exercises or functional range conditioning work. The warm-up can also be baked into the training movements by simply doing less intense variations of the movement, like squatting with the bar only before back squatting, or doing a handful of bodyweight pull-ups before weighted pull-ups. Building the microcycle. Microcycle is a fancy way of saying the training week. For today's example, we'll break down how to write 3 training sessions a week. We can reverse engineer the microcycle by calculating how many total movements we'll be doing in a week. For example, if we are planning on 6 movements per day multiplied by 3 days per week, we know the athlete will complete a total of 18 movements. From there, we know we have 18 movements to work with and can decide how to use those 18 movements. This is where the bucket system comes in handy. We use movement categories that are broken up into the following: lower body, total body, upper body. We can then allocate how many lower, total, and upper body movements we'd like the athlete to perform based on their weaknesses. Here's an example of what a program could look like for an athlete with a strong upper body but can't jump high. This program has a total of 8 lower body, 5 total body, and 5 upper body movements within a week. Here's another example of what a program could look like for an athlete with a weak upper body but jumps high. This program has a total of 4 lower body, 6 total body, and 8 upper body movements within a week. Once the movement category is decided, the coach or athlete can decide what the movement's subcategories should be. Pre-calculating the number of movements allocated towards a specific movement category helps to prioritize the needs of each athlete. This method can be used whether the athlete is training once, twice, or 3 times per week. Note, the younger an athlete is, the more balanced the approach should be, with a big emphasis on athletic development. The exact method of exercise selection is beyond the scope of this video, and we'll discuss them in future videos. Building the mesocycle. Mesocycle is a fancy way of saying a training block of 2 to 10 weeks. An easy way to plan your general mesocycles is to count backwards from important competitions or seasons and assign training themes to each week. Here's a simplified example. We use training themes based on the velocity of movements and primary physical quality that is being developed. In this context, physical quality is defined as a specific physical attribute or capability. We like to vertically integrate our training, meaning all physical qualities are trained within a day or microcycle, but the volume and ratios of the specific training stimuli will vary depending on the time of season. The TLDR version of this is we use bodybuilding tactics, strength development, and power development all year long, but we change how much of each tactic we use depending on the time of season. Note, We won't cover macro cycles or training blocks of 6 to 12 months in this video because long-term plans often change, which makes meticulous planning less practical. Injury risk reduction. We purposely use the term injury risk reduction instead of the more popular injury prevention, as it's impossible to guarantee injury prevention. Freak accidents and overuse injuries can happen anytime, but a smart dryland training program that builds the robustness of the athlete greatly reduces the risk. Building robustness in athletes through strength training is not new and has been studied in other sports. A 2013 meta-analysis conducted by Lorson, Bertelsen, and Anderson analyzed 25 trials and over 26,000 participants from varying sports. The authors concluded that strength training reduced all sports-related injuries by a third, and overuse injuries may have been cut in half. With such compelling data, dryland training should be considered a low-hanging fruit as it pertains to injury risk reduction. An injury risk reduction program should be more than a group of swimmers performing randomly assigned banded rotator cuff exercises on the pool deck. A true injury risk reduction program is a holistic dryland training program that addresses the needs of each athlete. The three commonly injured sites of aquatic athletes are the shoulders, knees, and lower back. The detailed injury risk reduction strategies for each of these sites and other areas are beyond the scope of this video, but we'll discuss them in future videos. Shoulders. The basic principle to understand for reducing injury risk in the shoulders are to maintain adequate shoulder flexion, shoulder external rotation, and T-spine mobility, while developing strength in the rotator cuff and periscapular muscles through external rotation, scapular upper rotation, scapular posterior tilt, and shoulder flexion. Lower back. The basic principle to understand for reducing injury risk in the lower back is to maintain adequate T-spine and hip mobility while developing strength in the torso and glutes. Lower back injury risk can also be mitigated through learning how to hip hinge, create intra-abdominal pressure, and control pelvic movements. Knees. The basic principle to understand for reducing injury risk in the knees is to maintain adequate mobility in the hips and ankles while developing strength in the glutes, quads, hamstrings, adductors, and lower leg. Conclusion. To break down and simplify everything we discussed, the three major steps to write an effective dryland training program are to 1. Assess. 2. Design a program based on your strengths and weaknesses while remembering that strengths and weaknesses are dependent on your sport. Upper body pulling strength doesn't matter as much for a soccer player as it does for a swimmer. 3. Train different velocities in different quantities at different times of the year. You can periodize a dryland training program by counting backwards from important competitions and assign training themes to each week. If you found this video helpful, check out our community platform at aquaticsp.com for future educational content, training programs, mobility modules, Q&As, and more. We'll also post videos that explore topics we didn't cover in detail here. The link is in the video description below.